Hello everyone and welcome back to the channel. Today we're talking about two very important kidney related problems, kidney stones and urinary tract infections, also known as UTIs. These conditions are different, but they share one important thing in common. If they are ignored or left untreated, they can lead to serious kidney damage. So in this video, we'll cover what causes kidney stones, the different types of stones, their symptoms, how to prevent them, how UTIs can affect the kidneys, what recurrent UTIs mean, and when does a urinary tract infection become dangerous. Let's start with kidney stones. So, what causes kidney stones? Kidney stones form when certain minerals and salts in the urine become too concentrated. Normally, these substances stay dissolved and pass out of the body harmlessly. But when there isn't enough fluid in the urine, they can stick together and slowly form hard crystals known as kidney stones. And several factors increase the risk of stone formation, including not hydrating yourself well or not drinking enough fluids, high salt intake, taking excess animal proteins, certain medical conditions. If you have a family person or member who has history of kidney stones, then your risk of developing kidney stones becomes higher. Living in hot climates where dehydration is common. Simply put, when your urine volume is low, stone-forming substances are more likely to build up. So what are the types of kidney stones? There are several types of kidney stones, and each stone forms for different reasons. The most common types include calcium stones, which are often linked to your diet, salt intake, and low fluid consumption. The second type are your uric acid stones, which are associated with very high protein diets and conditions like gout. The third type are your struvite stones, which usually develop as a result of repeated urinary tract infections. And the fourth type are your cystine stones, which are caused by rare inherited conditions. Identifying the type of stone is very important because it helps the doctor determine the right treatment and the right prevention plan. So what are the symptoms of kidney stones? Now, kidney stones may not cause symptoms until they start to move within the urinary tract. And when symptoms appear, they can be very dramatic. They often include very sudden onset, severe pain in the back or on the flanks, or which is the side, and that pain that spreads towards the lower abdomen or groin. Sometimes patients can notice blood in the urine. They frequently have nausea or vomiting, and they notice that they have frequent or painful urination. Pain from the kidney stones often comes in waves and can be extremely intense, sometimes requiring urgent medical care. So, can you prevent kidney stones? The good news is that many kidney stones can be prevented. Key prevention steps include drinking enough water to keep the urine pale in color, reducing salt intake, and that is key as well, eating balanced amounts of proteins, following dietary advice based on your stone type, and this is extremely important, and treating any underlying medical conditions like recurrent urinary tract infections. Of all these steps, hydration is extremely important. Consistent fluid intake helps to flush out the stone-forming substances from the kidneys before they can cause problems. Now let's move on to our second topic, urinary tract infections. Urinary tract infections usually start in the bladder, but if they aren't treated promptly, bacteria can then travel upwards to the kidneys. And when this happens, it can lead to infections in the kidneys, and this is called pyelonephritis. Kidney infection can damage the kidney tissue, which can lead to scarring, and this is permanent. It can trigger acute kidney injury as well, and worsen existing kidney disease. This is why urinary tract infections should never be ignored. Early treatment protects the kidneys. So what are recurrent urinary tract infections? When you talk about recurrent urinary tract infections or recurrent UTIs, it means that somebody is having repeated urinary tract infections over time. And they may occur because of incomplete treatment of previous infections, or we're using the wrong antibiotics to treat the infection, blockages in the urinary tract, kidney stones can also cause recurrent urinary tract infections, structural abnormalities of the urinary tract, or a weakened immune system like when you have diabetes. Repeated infections increase the risk of kidney scarring, especially in children and in older adults. Finding and treating the underlying cause is critical to preventing long-term kidney damage. So when do urinary tract infections become dangerous? A UTI becomes dangerous when symptoms worsen despite treatment, systemic symptoms like high fevers or chills develop, back pain or flank pain develops, which is a sign of pyelonephritis, nausea, vomiting becomes persistent, preventing fluid intake, or the infection spreads into the bloodstream. This can lead to sepsis, which is a life-threatening condition that requires emergency care. Any UTI accompanied by high fever, severe pain, confusion, or weakness needs immediate medical attention. Kidney stones and UTIs are common, and they should never be ignored. Staying well hydrated, seeking treatment early, and understanding warning signs can prevent serious kidney damage. If this video has helped you, please like, share, and subscribe. And always remember, early action protects kidney health. Thank you for watching.